have it a couple of times. So I think
it begins with A.
yeah. Thank you. But John, I think you painted a rather bleak picture. It's not that the company is necessarily risk averse like our sister companies. It is that if you allow me to finish, we're probably risk averse internally. A large percentage of my time is actually spent looking externally. At two different levels. One is early phase investments in a variety of startups, and there's no law saying that that startup can't be located in a university campus or be a spin out of the university campus. In fact, many of the startups we look at actually contain IP that came out of universities. And then, of course, we look at mature companies to buy so that we have a product, or we're near a product that we can market in a year or two. Obviously, we run in a very different manner from universities. Coming from background of having run a university lab, the big difference is in a company, to put it very bluntly, in addition to responsibilities to physicians, to patients, and to employees, we have responsibilities to shareholders. So we need to keep the stock up. We need to keep putting dividend in the pockets of investors, kind investors who continue to invest in the company around the world. But the fact is that to continue to do that, and to continue to maintain the pipeline, we do continually look at the startup world, and not necessarily in our own space. I mean, you have to keep them, we're in the medical device space, and I'm in the cardiovascular branch of the company, but there are now devices in sleep apnea, there are devices in depression, there are devices in a host of other situations, which are probably going to take off in the next 5 years, 10 years, and 15 years. So I think it's not so much that we are fixated on a 1 month or 6 month or 1 year time frame. It is that there are different parts of the company that are fixated on different things. The commercial branch of the company that, as I said, needs to keep the stock up and put money back in the shareholders' pockets is focused on the short term and needs to be focused there. But there are research and development and medical affairs sides of the company that are focused on how to keep that pipeline moving. And I don't see the academia industry collaboration currently as bleak as you do. I think it's pretty good. But the fact is that it could be better, particularly in this business development aspect. Startup companies approach us all the time. It's not the other way around. And there's no reason why those startup companies can't be university-based approaching us. Because our job is to listen. Because if this is going somewhere, and at the end of the day is going to move the needle for us, we're going to put money in it.